The World Health Organization considers diabetes to be a global pandemic of nowadays. The world leader in diabetes cases and related risk factors are the Persian Gulf countries, particularly the United Arab Emirates. In 2016, in UAE, the prevalence of diabetes was almost 8%, whereas the prevalence of overweight people was 70%, and of those diagnosed with obesity was more than 30%. The situation is also critical among children. For example, in Dubai, 1/4 of the population below 18 years old are overweight, and more than 10% are obese. At 18 years of age, UAE female obesity was almost 2 times higher than the international standard. Moreover, the rising rate of extreme obesity is alarming, especially among boys. According to a population-based study with approximately 45,000 students attending public schools in UAE, from 15 to 18 years old, 10% of boys and 3% of girls were extremely obese. And it's the comforts of life, sometimes the most basic ones, that put the health of so many young boys and girls at risk. Affordable private cars, fashion-on housemates, as well as bad dietary habits and inactivity are among the key risk factors for obesity and diabetes in the Arab world. About 1/3 of UAE residents do not exercise enough. That's a lot. Couple that with a diet dominated by fat-rich street food, and you get yourself a nationwide problem. Statistically, if children between the age of 6 and 11 eat out just 5 times a week or more, half of them develop obesity. The rate actually goes down to 10% amongst those who mostly enjoy homemade meals. That's 5 times less likely. But if you think obesity is the biggest problem here, think again. Analyses show that there is a strong correlation between obesity and breast cancer among Arab women. Another study found that diabetes, hypertension, obstructive sleep apnea, and osteoarthritis also come in tow with obesity. All that burden drives up the cost of healthcare in UAE dramatically. Even the data we have right now suggests that things would get worse. And with about 35% of cases of diabetes going undiagnosed, the situation is likely to be even gloomer than it is already. By 2020, more than 1/4 of adult population in UAE may have diabetes or pre-diabetes. That would put the price tag of healthcare costs to $9 billion over this decade. Hopefully, food education programs and sensitization campaigns will reverse this alarming tendency. This is time to act.